Welcome again to another edition of Matters of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Cardiology. I'm Seth Bilazarian, a cardiologist with Pentucket Medical, and I'm here with my associate, Dr. Srivastava. We're here to discuss a topic that's near and dear to both of our hearts, but certainly mine, and that's the issue that many people ask about some dietary issues and how those dietary issues may relate to heart health. But today's specific issue is the dietary or nutrient coffee. And I am a coffee drinker, and I'm quite excited to hear what Dr. Sunny says, and I'm hoping that this is going to be good news for me because I am a regular 2-cup-a-day kind of guy.
I am a regular coffee drinker as well, and so it's something I've always wondered about and had opinions about, but hadn't dug deep into the data per se to see is it good for this or bad for this or whatnot, and I think there's a lot of assumptions made that it's not good for certain things, and I get asked about this quite a bit by patients, certainly, depending on what their conditions are, and so I figure, and then quite timely was, in one of our main publications, the Journal of the American College of Cardiology, just maybe a month or two ago, there was a very nice review article about the effects of coffee consumption on cardiovascular health and death even. Some interesting statistics about coffee, which probably doesn't come as much of a surprise. Behind water, it is the most commonly drunk substance in the United States.
It's behind.
Yes, right. The consumption continues to increase. 2/3 of American adults drink at least 1 cup of coffee per day. Then it puts that number at about more than 400 million cups per day. So it's a big, gigantic industry, obviously. And Americans drink more coffee than any other country in the world. And so as a result, even potentially small health benefits or risks associated with coffee intake are worth looking into because of the widespread consumption. So this article, which I'm going to review and talk with you about, dives into these things in a systematic way, looking at the data. Some questions are answered, some are not. And one thing that's important to note, and we'll get into this, is that many people just equate coffee with caffeine.
Right, so are there other things in there that are important?
Right, so there are a lot of biologically active components in coffee.
Okay.
And actually, what this article cites, hundreds, if not close to 1,000 different compounds in coffee. However, there's 3 main ones that I think draw our attention. One is obviously caffeine. That's the one that's the most studied. That's the compound that's the most studied. It's a potent stimulant, as we all know. It's a bronchodilator, meaning it can open up the airways. If someone has asthma, for example, there is something called a diterpene alcohol, and it's known to raise cholesterol. So that's an important thing to keep in the back of our minds. And then there are many antioxidant and anti-inflammatory compounds in coffee. The one that gets cited and talked about the most is something called chlorogenic acid. And so the point is that these other compounds have effects that are independent of caffeine. And so the studies that we're looking at are really looking at coffee. So they don't relate to soda and other methods of drinking caffeine. This is really about coffee because, as you'll see, there's definitely benefits to coffee that are not related to the caffeine as well.
May I ask a question that you may not know the answer to, but I'm just curious as you were talking. Coffee, as I know, is produced on several different continents. There's, Costa Rican coffee and Ethiopian coffee. Is coffee coffee, or is that?
Coffee's not coffee, but I don't know the answer of if you're asking, which one has more of this and which one has more of that.
But can we assume, for our discussion today, it's all coffee, though?
Yeah, for the purpose of today, but the way you prepare it actually makes a difference, we'll talk about, which is actually kind of interesting. But there is a high degree of variability in the caffeine. We're going to talk about caffeine again. So there is a high degree of variability in the amount of caffeine that's in a brewed cup of coffee. In the old days, I'll say it that way, a standard cup of coffee was 8 ounces. And so most of these studies are based on that 8 ounce equals 1 cup
So 8 ounces is a pretty small cup. It's almost like a teacup that people would have.
Yeah, I don't know.
Not a mug.
And most people I know don't drink just 8 ounces.
Right.
For example, I think we were debating this before. A small Dunkin' Donuts coffee is what, 10 ounces?
Right, 10.
So a medium was 14 ounces.
Yes.
A large was 20 ounces.
Yes.
And then there's an extra large, which neither of us really even realize that exists, was 24 ounces.
Right.
So the smallest Dunkin' Donuts is more than what?
It's more than 1 cup.
Yeah,
yes.
A little bit more than 1 cup. But so the statistics show that you can go to the same coffee shop, get the same 8 ounce cup of coffee, and the amount of caffeine can range anywhere from 95 to 200 milligrams.
Wow.
Same shop, same coffee, and it all just depends on how that particular brew takes place and what's extracted and what's not. It's not that consistent of a process. So it's a fair amount of caffeine, certainly. And it's important to note that decaffeinated coffee still has a small degree of caffeine in it, but much less. An 8-ounce cup has somewhere between 5 and 15 milligrams of caffeine. It's almost negligible to those who are sensitive to the effects of caffeine. So again, I do want to point out that caffeine and coffee are not synonymous, and that these studies that we're going to talk about and cite are really just looking at coffee and not caffeine per se. So the first thing we can jump right into.
Well, it's a stimulant, so I guess as a cardiologist, I'm interested, does it have a blood pressure effect?
Right, so that's the first thing we're going to jump into. And in the past, coffee consumption has been thought to have been associated with acute increases in blood pressure in those who are caffeine naive. So what that means is those who are not coffee drinkers. You give them coffee, it can acutely raise their blood pressure.
How much?
Anywhere between 5 and 10 points.
Okay.
Now, if you look at people who are habitual coffee drinkers, there's a negligible effect on the long-term levels of the blood pressure. And actually, with regular intake, tolerance develops, as you can imagine, as we all know.
So the body gets used to it.
Yeah, and actually, there's large studies, these things called meta-analyses, which look at a bunch of studies and put it all together and come up with conclusions. And I'm just going to look down at the data here, but the recent meta-analysis looking at 10 randomized controlled trials, those are good trials that we like in medicine, showed that there was no clinically important effect of long-term coffee consumption on blood pressure or even the risk of developing high blood pressure. It was even. There's big studies that you know, they're well known, like the Nurses' Health Study, which is a big study, showed the same thing. And actually, they looked at intake up to 6 cups per day.
Well, because they were nurses.
Right, that's right. So 48 ounces of coffee per day had no effect on increasing the risk of hypertension or increasing blood pressure.
Wow.
Which actually I found surprising. I actually didn't think that was going to be the case.
Especially at the higher doses.
Yeah, and I consider 6 cups a day a high amount.
Right.
So
how about other metabolic things? Like, obviously we think about it has some appetite effects. Does it have any effect for a risk of diabetes, isn't it?
it does. And then one last thing I wanted to say about the coffee is that it's thought, and no one's really quite sure why, but it's thought that some of the other compounds in coffee offset the effects of caffeine, some of these antioxidant and anti-inflammatory effects, and that there's some interplay of these that causes it to have a neutral effect. But yeah, so you asked about diabetes. And again, it comes back to these antioxidants. The chlorogenic acid specifically is the one in coffee. These antioxidants in coffee have been thought and actually been recognized to improve your glucose metabolism and, more importantly, improve your sensitivity to insulin, which is a really important thing, certainly. And so caffeine can, and I won't get into the science of the pathways of how this gets done, but caffeine can ultimately decrease your insulin resistance. It improves your ability to secrete insulin, and therefore improves your blood glucose levels. And then there's studies, again, I'm going to look down at the studies, but there's some big studies looking at multiple studies, so these meta-analyses. The risk of developing, in these studies, there was actually a direct relationship with more coffee you drink, the less likely you are to develop diabetes. And so the risk of developing diabetes was lowest in the subjects who drank more than 6 cups daily. Those who drank 4 to 6 cups daily, it was significantly reduced. And it keeps going down this way. So even if you drink a tiny bit, that risk is reduced as well. But any degree of coffee consumption was thought to reduce the risk of developing diabetes.
Was that a caffeine effect or what's
No, so it's also included decaffeinated beverages too.
Okay.
So look, it's not a cure-all by any means, and saying that you drink coffee and that way you're never going to get diabetes. That's not the message to give here.
So far, if you drink coffee, it doesn't hurt you from a blood pressure standpoint.
Yeah.
It maybe doesn't hurt, maybe even helps with diabetes.
Yep.
So let's keep going then. How about cholesterol?
So cholesterol is it's a trickier one. It's interesting. So as I mentioned at the outset, there's a compound in cholesterol called ditterpene, and ditterpene is known to increase cholesterol. However, what they've discovered is that it all depends on the method of how you prepare the coffee. Boiled coffee has a very high concentration of these ditterpenes because of the prolonged contact with hot water. I don't know too many people who boil coffee beans to make their coffee, but other places in the world maybe so. But nevertheless, the boiled...
Or when you're camping.
Well, right. Yes, I don't camp much, so yes. But boiling your coffee will have higher levels of these ditterpenes. Whereas brewed or filtered coffee, I think where most people are drinking, is a much shorter contact time with the hot water, and the ditterpenes are retained by the filter. So the finished product doesn't have anywhere nearly as high of a concentration of these ditterpenes as the boiled coffee does. And that's important because actually looking at these studies, there was actually a significant increase in total cholesterol and a non-significant increase in LDL, the bad cholesterol, in people in the study who drank boiled coffee. On the other hand, if you're drinking the brewed and filtered coffee, there was no significant difference or change in the total or LDL cholesterols at all. So I'm just looking to see if I had other studies. And these were replicated in other big studies. There was, again, the Nurses' Health Study, which is a study of over 100,000 people. These findings were replicated. And also, tea had similar effects as well. So I wouldn't say that it really does anything good or bad for your cholesterol profile if you're drinking traditional.
All right. So pretty neutral blood pressure, diabetes, cholesterol. Mm-hmm. So overall, how does it do for our heart in general? What would you say heart disease risk?
So that's an interesting question as well. Decades-old studies had suggested that coffee consumption might cause adverse cardiovascular effects, thus raising your risk of heart attack. But as people became more sophisticated in doing studies, they realized that there were a lot of confounding variables in those studies, such as smokers, fat consumption, physical activity, not physical activity. And so when you start correcting or adjusting for these, it actually turns out that the risk of death from a cardiovascular cause seemed to be lower in coffee drinkers, which is a nice thing to hear, certainly. And again, I looked down at some of these studies here. Again, these meta-analyses. So these aren't the best studies out there, but they're good studies looking at grouping up independent, smaller studies, showing that moderate coffee consumption may decrease the long-term risk of coronary artery disease. Compared with light to absent coffee consumption, moderate coffee consumption was associated with significantly lower rates of coronary artery disease, men and women. And these are statistically significant differences. So many studies have gone on to show that it is quite safe for patients with established coronary disease to continue their habitual coffee drink. I can remember many people coming to me after their heart attack saying, I shouldn't drink coffee anymore, should I? And we'd have a conversation. I would say, yeah, if you're drinking a cup a day, I think that's fine. I wouldn't have firm data one way or the other. And really, these are pointing to the fact that it is perfectly fine to continue onwards with your habitual coffee consumption. And interestingly, I think, based on a talk you were giving recently, talking about markers of inflammation and risk, looking at something called CRP, C-reactive protein. More recent study shows that acute caffeine ingestion, so not coffee per se, but caffeine ingestion lowers your CRP level. So interesting, certainly, that there could be some beneficial effects to coffee in the heart.
So you talked about heart attack. I mean, how about any other disease entities like stroke? Is there a risk there?
There's stroke, so absolutely stroke. Studies have uniformly shown that there is the likelihood that coffee consumption can reduce the risk of ischemic stroke. Ischemic stroke is different than what we call embolic stroke, stroke that comes from atrial fibrillation and clots in the heart and things. So from the stroke that most people think about, there's a thought that coffee can reduce the risk of that. And what the studies show is that 1 to 3 cups of coffee were associated with a decreased risk of stroke. There was a statistically significant decrease in stroke. And those who are heavy coffee drinkers didn't seem to make much of a difference in the risk of stroke, didn't decrease it. So it was the moderate or light coffee drinkers in whom that made a difference. And there's multiple, and I could cite, there's lots of different studies that showed the same thing over and over again with regards to stroke.
So far you told us that most of the risk factors like blood pressure, cholesterol, diabetes, neutral to small good things happening. You told us with heart disease, like heart attack, neutral to small benefit. And then you told me with stroke, neutral to small benefit. Is that a summary of what we told me?
Yeah, and maybe not so neutral unless, again, these studies are, some of them are observational studies, some of them are meta-analyses. These are not as good as the randomized placebo-controlled studies that we like to consider as gold.
Hard to do with coffee.
Right, so it's hard to do. So, you got to make do with what you have for information.
Sure.
And so I wouldn't emphatically tell someone, you're not going to have a stroke if you drink coffee.
Right, but it also sort of gives us feeling that someone who has multiple other risk factors, that we're not adding to the risk with coffee.
No, that I feel very comfortable with, absolutely.
So how about, talk to us about, then you talked about 2 really important things that cause death, heart attack and stroke. How about just all-cause death, mortality?
Yeah, before we get to that, there's one thing I want to jump back to about congestive heart failure and arrhythmias, because people always ask about coffee with arrhythmias.
Okay.
So I want to talk about that, and we can talk about mortality and death. With regards to congestive heart failure, the data is, and congestive heart failure for the audience is fluid retention in the legs or the abdomen or the lungs. It's coming from the heart often. The data is a little interesting. It's almost like a U-shaped curve when you look at the data, where there's an increased risk for congestive heart failure exacerbations on those who are heavy drinkers and low drinkers. The moderate drinkers seem to do okay. So I don't know what to make of that. I don't know if that's just a screwy finding of the way a study was done, or I didn't have as much confidence, and the authors also didn't have much confidence. They just dedicated one small paragraph to the topic. You have any theories as to why that would be the case?
No, I don't.
I mean,
I don't.
that's observed in other entities, that U-shaped curve.
I mean, if you told me there was a U-shaped curve for blood pressure or cholesterol, then I would say, well, that sort of makes sense, because that might be the way it affects heart failure. But without that, I would say it's difficult.
Right, so I don't quite understand that. But the big one that people often talk to me about are arrhythmias. So fast heart rhythms, we, I think, often counsel patients to avoid caffeinated beverages as a result. And early animal studies indicated that coffee may have caused arrhythmias in certain canine models and such. But more recent studies suggest that coffee actually appears to not increase arrhythmias at all. And in fact, to the contrary, long-term coffee consumption may actually reduce the risk of abnormal cardiac rhythms. So there's been big studies out the Kaiser healthcare system out on the West Coast, over 100,000 patients, showing a very direct and inverse relationship between habitual coffee drinkers and the risk of hospitalization for arrhythmia. So that's a surrogate marker, but it's a good one nonetheless. Other studies showing no clinically significant increase in ventricular or supraventricular arrhythmias, which also is a very good finding. What else was there? There was those who have established ventricular arrhythmias, there's no increase in recurrence of the ventricular arrhythmias. Those who go to the EP lab, so we sometimes bring patients to, it's like a cath lab, but an EP lab, a suite where you're trying to figure out what type of arrhythmia they have, and you're trying to induce ventricular tachycardia, a fast, dangerous heart rhythm, to see if someone's prone to that, and you could treat it accordingly. And these EP studies suggest that caffeine consumption does not make you more inducible for having those ventricular tachyarrhythmias. So that's a great finding as well. The mechanism, it gets a little too sciencey. It's not entirely known what the exact mechanism is. A lot of it's thought that caffeine and how it relates to adenosine and how that plays a role with arrhythmias. It's beyond the scope of this conversation, certainly. And other things that, looking at atrial fibrillation, another type of arrhythmia. It's a supraventricular arrhythmia, but another type of arrhythmia. The big women's health study where it looked at 35,000 women showed no increase in the incidence of atrial fibrillation in those who drink moderate amounts of coffee. And the Framingham Heart study, same type of findings as well. So those are very good, somewhat surprising, I think, to the average person findings regarding coffee and arrhythmia. Now, it's a little different for palpitations. People have palpitations where they sometimes get extra beats in their heart, premature ventricular contractions, premature atrial contractions. Those aren't necessarily considered arrhythmia to you and me, but coffee can provoke those, absolutely. And so it's a little different than what you find with more sustained arrhythmia. So you were asking about, when I cut back to some of these other things about mortality, so death. How does coffee affect death, dying, et cetera? And actually, studies, and these big ones, these NHANES, which is a big, gigantic study, these big studies show that coffee, and I'm just going to read directly how they quoted it, coffee intake of participants who were 65 years age or older exhibited a dose-response protective effect, whereby increasing habitual consumption of coffee was associated with lower risk of adverse cardiovascular events and heart disease mortality. So they're saying that drinking coffee led to fewer heart attack, stroke, death. Is that how you understand that statement?
Yes,
there?
yes. Yeah. But not all cause mortality. I mean,
correct. No, the death attributable to a cardiovascular cause.
Right.
And it's seen in other studies as well, the same type of thing. And it's seen in both decaffeinated and caffeinated. Men, women, black, white. It's seen across the board. Same type of thing. Now you're asking about what's called all-cause mortality. I think when they tease it out, and I'd have to go dig deeper, that any reduction in mortality is really attributable to the alteration in cardiovascular deaths. So not all-cause mortality per se.
I mean, the reason why I asked that for our audience is that, you know, if you reduce heart death but you increase cancer death, that's not very good. So we want to know that if you're reducing heart death, you're not causing some other kind of death.
No,
So.
that's not found, that you're causing other kinds of death. Now, interesting, so one study here, it was the AARP and health study from the NIH, 230,000 men and 170,000 women, so pretty large numbers, observed that when you take out things for tobacco and other potential confounders, men who drank 6 or more cups of coffee per day had a 10% lower risk of death, and women had a 15% lower risk of death, irrespective of whether they drank caffeinated or decaffeinated. And the associates were observed due to death from heart disease, basically. So that's a good thing. That's a good finding with coffee.
Yes, certainly is. So are there any other, we've obviously, as our show says, matters of the heart. While we're on the topic, and we have our focused attention on coffee, are any other comments about other health issues?
Yeah, so, and this is where they don't have as much data, but there's lots of other things that coffee can affect. There is thoughts that coffee can reduce the risk of depression. There are studies to suggest that's the case. There are studies to suggest that coffee can help assist with efforts at weight loss or weight control. There are some studies to suggest that it may reduce the risk of developing Alzheimer's disease, that it may slow the progression of Parkinson's disease, it may improve asthma. Caffeine has a similar compound into it than what we see in some of the medications that are used to treat asthma. It's a dilator, it's a bronchodilator. It can certainly enhance performance in athletic events. There's thought that it might help prevent gallstones. And then there's some loose association where it might affect certain malignancies in a good way, specifically liver cancers, reducing the risk of liver cancers. Now there's some bad things too. So
We haven't heard any yet.
yeah, so
What are they?
well, certainly there's calories, and people are pouring cream and sugar into their coffee.
Well, don't blame the coffee for that.
And so, well, no, not blaming the coffee for that, but the fact of the matter is many people who drink coffee do not drink it black, and so that changes things a little bit. And many people have palpitations or anxiety or tremulousness with coffee. That's a direct link to caffeine, no doubt about it. It can interact with certain drugs, that if the caffeine and some certain drugs, such as one that's used for asthma, theophylline, for example, the two together can cause people to be quite jittery and tremulous and really exacerbate the anxiety or palpitations that one might get. There are some implications with high levels of caffeine consumption, that the increased urine output that comes from it, and with that urinary calcium and magnesium excretion, that there can be some negative effects on bone health. And it's thought that the amount of mineral loss or calcium loss from consuming 1 cup of coffee can be easily counteracted by putting 2 tablespoons of milk into the coffee, or if you drink milk later on in the day, that's a way of counteracting it. But that's really sort of the main negative.
So not much negative.
No.
Probably a bunch of slightly positive,
Yeah.
but mostly neutral effects.
Yeah, neutral or positive.
So we basically should,
If you drink coffee and you enjoy it, keep drinking coffee and keep enjoying it.
right. I mean, especially if that last caveat you gave at the end about adding sugar, and we know a teaspoon of sugar has 4 grams of sugar in it, and we're trying to limit amount of sugar per day to under 20 grams per day. So you put a couple in, you're already well
yeah.
down
I
the
mean,
road. So we're not talking about that.
Right. No, if I'm in line at Dunkin' Donuts, I'll see people get their extra large with extra cream, extra sugar. That's no good. That's
Right.
not what we're talking about.
Right. So we're talking about just
Yeah.
coffee, and if you're enjoying coffee, as we have said about some other nutritional issues, enjoying it at a rate that's even up to 6 cups a day, we don't have good evidence to prohibit that.
Right. And it's interesting, coffee obviously develops some sort of physical dependence in people, and some
People get caffeine headaches.
yeah,
and they
there's
get-
withdrawal symptoms, absolutely, irritability, headache.
So they got to have their coffee.
Yeah, and so some may argue, well, this is comparing it to other addictive agents like alcohol or opiates or other drugs. And I think most public health advocates feel that caffeine is not a serious dependence, much like those other ones, that there's no real public health ramification or negative effect from it, even though there are some addictive qualities to it or dependency qualities to it. I think most would agree it does not fall in the same realm as the other vices I just mentioned.
All right.
I think that's kind of a summary of it, that I think in the end, as you summarize, coffee consumption is mostly neutral, if not good, not bad for most things that are cardiovascular in nature. And so people who drink it and enjoy it should continue to do so, and not pour in wads and wads of cream and sugar in there.
Right. But one of the things that you said that you sort of said loosely, but I want to be clear, we don't really have specific data, I think, from anything that you shared or from this review article that says it is safe in heart patients. We're just sort of extrapolating that it probably is safe in heart patients because it doesn't predict heart failure or doesn't predict heart attack. So, but it does give us some confidence that it's safe for people
Yes.
after a heart attack or with heart failure to return to enjoying
And
a
that was
cup of coffee.
one of their conclusions, but these authors who wrote this paper, one of their conclusions was just what you said, almost just like that, verbatim. So, so absolutely.
Great. Well, what a fantastic review on a topic that's near and dear to my morning habit, and that's
Yep,
drinking
mine too.
coffee. And Dr. Sunny Srivastava has reviewed an article from the Journal of American College of Cardiology, which reviewed a wealth of literature on coffee, trying to help us understand what's safe, what's reasonable, and helped us understand that at the end of the day, what he's taught us, taught me and hopefully our audience, that there are neutral effects for most risk factors for heart disease, like blood pressure and cholesterol, certainly with chronic regular use. Maybe some actually positive things with diabetes. There's probably some positive effects for stroke. For other vascular issues, probably neutral or maybe slightly positive. And that overall, other than jitteriness, addiction, and palpitations, he didn't tell us very much negative for this. So we would just certainly recommend it. And in many good things, moderation is recommended. We want to sort of recommend moderation here, which is, I guess, up to 6 cups a day. And 6 cups would be 8 ounces. Right, 8 ounces. And we just refreshed, at the beginning of this, we mentioned that, for instance, medium-sized coffee, which is a popular one, at least that I know of, at Dunkin' Donuts would be, 14. We said 14 ounces. So if you had 2 of those, that would be 28 ounces. So using your criteria, 8 ounces, that's like 4.5 cups already. So 2 mediums is probably a reasonable amount to limit yourself to. Is that a fair summary there?
That's a fair.
Excellent. Well, thank you again, Dr. Srivastava, for continuing to be our expert on nutrition and cardiovascular issues, and this week's episode covering coffee. So until next time, I'm Seth Bilazarian from Matters of the Heart, coming to you from Haverhill Community Television and Pentucket Medical Cardiology. Thanks for joining us.